Hi beautiful people, hello, welcome back to my channel. If you're new here, my name is Lilian Shiro. I trained back in Kenya as a nurse and I apparently work in the UK as a registered nurse. So guys, in today's video I'm going to give you the courses that you can do online, and they are going to give you the health caregiver certificate, and these are accredited certificates for UK British system. If you're new here, please subscribe to this channel, like the video, and also share. Also, please share your thoughts in the comments below, and if at all you have any questions, please do ask in the comments section below. So without further ado, let's get into the video. If you're willing to come and work in the UK as a caregiver or as a healthcare assistant, either a senior healthcare assistant or a healthcare assistant who is a carer, and you're wondering where to get the certificate for the healthcare giver certificate, remember when I did the first video, I did mention it was a requirement. You're required to have a caregiver certificate. And this is why I'm doing this video, because in my previous video you see where I was giving you examples of the jobs, the healthcare assistant jobs with Tier 2 visa. You remember that I had read somewhere, and I'll put it somewhere here, the requirements for you to have a job here in the UK as a carer or as a senior healthcare assistant. And this is what we had. The employers, they were asking for the level 2 diploma in health and social care certificate. So it's beneficial if you have that caregiver certificate. Number 2, it was NVQ2 health and social care certificate, which is also beneficial if you have it. And number 3, it was training to care certificate standards beneficial. So you need to have training, you need to have that care certificate standards, which are supposed to be 15. So guys, I'm going to go through this and tell you exactly what you are required to study, the courses that you're required to study. And you don't have to hustle, guys. I know some of these courses, they are not out there. There are some, like now, there are some places where they already have the nurse aid courses, but not all the countries that they have a direct nurse aid course. Because as I remember, I said in Kenya, there's a 1-year diploma that you can do in the Kenya Medical School to have that certificate. You can also do in the Red Cross. There are some, some trainings which are related, but they are not really like specifying whether it's a healthcare giver or a nurse aid. It's only that it's everything included. And so because it's very hard to get these courses, it's now, this video now, it's for you, because these courses you can access them online. And that's why I want to go through what I've just read for you. And also I'll be sharing with you free courses, the health and social care courses that you can do online, and they are free of charge, guys. So I'll take you through the courses that you can pay, and I'll take you through the courses that are free of charge, so you're not gonna pay for anything. That one is like to supplement these 3 courses which are here. So amongst the 3 courses which I'm gonna read for you here, you're gonna choose the one that you want to do, and then I'll guide you. I'll tell you which one I would advise you, I would encourage you to do. So guys, as always, I like sharing my screen, and the reason is why I like sharing my screen. Most of the times I've gone through these things that I'm sharing with you, but when you're doing your studies or when you're researching, you know, at times I've been stuck before when someone tells me about information and they don't even tell me exactly what I'm supposed to look for, you know. So you go, you start looking, and then you have so much information that confuses you. I don't want that for you guys, and this is why I always share my screen and show you where exactly you'll be looking for. So if maybe you've had me mention something and you are taking your notes down, you can always pause my video and take a note, yeah, so that you can see where you're supposed to go after the video. If you're doing your own research, where you're going to do your research, or where you'll be searching. All right, I'll start with the first one, which is the easiest to access. It's very cheap, it's £10. I'm going to start with that one, and you'll be having 15 modules in this Care Certificate standards. Okay, and so I'll just go straight and then I'll share it with you guys. So I just look for the Care Certificate standards. Care Certificate standards 1 to 15, yeah, of course, but let me just tap the general one there, and then you see it shows already I was already in this page. So I usually come to you guys when I've already done my research, but I'm always open to any suggestions, any opinions. So if at all you've done your own research and you feel maybe you'd want to supplement what I've already said or what I'm saying, you are more than welcome. Okay. So we'll start with this one, guys. £10 is just 1,200 if you're in Kenya. If you're in another country, guys, please do your research and convert to your own money and see how much you'll be expected to pay. Yeah, so here you go. You see here you can enroll. Can you see enroll now? This way you're supposed to, and then you'll be doing individual. You see this one has already like have a blue dot in it, so it's the one that is recommended there. If it was group, it would be there, yeah, but now we are not doing group, so we are doing individual. So you go there, you enroll. It's a 14-day money back guarantee. So I don't know why they would want to give you your money back anyway. Probably if something goes wrong, probably they will return your money or something like that. But anyway, let's see. So I just wanna come down and probably just explain to you what it is about these 15 Care Certificate standards for you. And I'll read it through. You know, guys, I always like reading it through. And that's why I'm saying, if you feel like you're lost, you can always pause my video. You go through, take your notes, yeah? And then you can go back and review once we are done with the video. So, what are the 15 Care Certificate standards? The Care Certificate is an agreed set of standards that define the knowledge, skills, and behaviors expected of specific job roles in the health and social care sectors. It's made up of 15 minimum standards that should be covered if you are new to care and should form part of a robust induction program. You can also complete the Care Certificate if you're working in a non-care working role. For example, if you work as a cook or a maintenance person. Yeah, that's true, guys, because you see, like I've been working in care homes. We have maintenance people there, we have the cooks, like and environment is the same, and also we are working together towards delivering care to our residents or the care service users. So all 15 Care Certificate standards, so included with the Care Certificate is the following. All 15 Care Certificate standards, CPD, it's continuous, you know, practice, what? CPD? Continuous practice, what? Jesus Christ, I just did my revalidation. Okay, CPD accredited online. Learning following the care frameworks, learners, certificates, reporting, and CPD points securely held online. Free skills for care, care certificate workbooks, free skills for care, care certificate standards booklet, free skills for care employer progress log, mapping and sign-off document. There's something I want to say. Now we've come to the point that I want to explain to you guys, and this is why you are required to have this caregiver certificate or the care certificate standards. But these are the same courses that we usually do. Even us as nurses, we still do like yearly, annually. So once it's expired, you have to like do an online course again to keep yourself up to date. So module 1, care certificate standard 1, understand your role. Of course, if you are a carer, if you are a senior carer, you need to understand the role that you have to contribute or working towards to. And then module number 2 will be care certificate standard 2, your personal development. You have like your personal development. How are you improving yourself towards the care that you are providing? Number 3, care certificate standard 3. These are modules, guys. Duty of care. What's your duty of care? Like, what's like your accountability, if you ask me? If you're going to work and you'll be doing like the work, do you just work just because you're supposed to be working? No, it's your duty to do this work, and you should do it perfectly, and you should do it the way it's supposed to be done. Yeah, so that is duty of care. Then we have care certificate standard 4, awareness of equality, diversity, and human rights. Hey guys, so this one, the way you're supposed to understand is equality. Let's say like in UK, guys, it's interracial. You're working with people from Philippines, from India, from Africa, from all over the world, you know, Caribbean, from America, you know, the locals. And so you have to, at place of work, you have to be equal. You have to treat each other equally. Again, remember, most of the time when you come to work here as a carer, you are working towards the elderly. So you have to make sure, because you are young, don't feel like, how can I explain it? You need to be compassion, you know? You need to be compassion, and even these residents, you need to treat them the same. Only that, a point which I'll come to, only that you have to give self-centered care, personal-centered care, yeah? But you have to treat people equally, your colleagues and also the service users, the residents that you are working towards to. So, care certificate standard 5, work in a... I don't know how these things usually flow, guys, because you see, number 5, work in a person-centered way. Yeah, this means, guys, don't treat, I know I've just said you treat everybody equally, yeah? But now, this working in a person-centered way, it means, let's say in a care home setting, and we have two different residents with different needs, yeah? Don't assume because this one takes tea without sugar, the other one takes tea without sugar. Don't assume because this one takes coffee without milk, the other person should be taking coffee without milk. Don't assume, guys. You need to know your residents' needs so that you can contribute towards that, yeah? So when you're giving them your services, you know exactly this person doesn't eat fish. So if at all it's fish which is being cooked today, there's a way, or you've communicated to the cook and they know exactly that so and so they're not supposed to eat fish. So that's what I'm supposed to say. If there's someone who likes to having shower like daily or maybe twice a week, don't compare them. Don't put them in that class where you're giving probably showers once in a week. No, person-centered care. If this person wants 3 showers in a week. Please don't place them or in a group where you're giving one shower once in a week. Okay. Then number 6, care certificate standard number 6, communication. Guys, communication skills. Wow. This one, I know most of us, we have trouble with communication. I don't mean that you don't know how to talk. Guys, when you're in a healthcare sector, yeah, you need to know how to communicate. You need to know how to convey the message, because you might say something and to the other person, they will understand something different. So you have to be clear with what you're saying. You have to have humility. You have to have compassion towards the people you are talking to. Yeah. Not only that, communication again would come, amongst the colleagues. When you're talking to your colleagues, please have respect. You need to respect your colleagues. Don't think because these are junior staff, they just came the other day, they are new, so you are like putting them off. Please, no such behavior. Communicate properly with your colleagues, because someone will say, you ask them, why was this and that not done, but then you say, no one told me. Then I, as a nurse, I'll go to this, maybe the senior care staff, and I'll ask them, why did no one tell so and so that they were supposed to do this? I don't know whether you get my point. So we have to work together, and this one comes with communication. And also communication, guys, comes with documentation. Yeah, there are some information we don't just say by mouth. We need to put in the papers. Yeah, and you need someone to show you the right documentation to be done. Yeah, so communicate with others with respect. There's no one who is bigger than the other one. Yes, we have maybe bigger roles or stuff like that, but please, we are equal. Remember the diversity, equality and diversity. You have to remember that. So you have to respect one another. Okay. And something else, if you don't know anything, please always say you don't know anything. Don't do something then you do it the wrong way. Always say, tell it to someone, ask someone how you're supposed to do. Then we go to number 7. Care certificate number standard 7. Privacy and dignity. Guys, don't say because you're working in a care home, yeah, that because this person has dementia, they don't know, or they don't recognize, or they don't have self-awareness, yeah, and you think you can just take someone to the toilet and don't close the door. You think you are doing showers and don't close the door. Privacy and dignity. Even if you are helping them to like dress in their own rooms, please close the door. Yeah, so you respect them and you are promoting their privacy and dignity. So remember that. Then number 8, care certificate standard number 8, fluids and nutrition. So fluids and nutrition, there are some people where you find you have to monitor their daily intake, both fluid and also the food. Yeah, so there are those people who have fluids restrictions, yeah, or there are those people who have been told they need to have more oral intake, like the fluids. So for you to promote the nutritional status, you need to work towards the like required food and fluid intake. Also, you'll be required to record this, not for everybody, but that person who has been identified that they need to be monitored, you have to record what they have been eating the whole day and the whole night. So it will be 24 hours balance. Number 9, care certificate standard 9, dementia awareness. I think I've just mentioned dementia. Dementia it's a very complex condition, yeah, that you need to learn more. Mostly if you're coming to work in a care home, there are so many people who have dementia. Not all care homes deal with the dementia, but you need to have at least the slight knowledge about dementia. And with dementia people, you find maybe they have some symptoms where they are confused, where they have lost memory, such things, guys. And you need to be compassionate. You need to help these people, you know. I know I've mentioned this in my last video. You need to know how to like help these people, because if someone is confused, let's say it's meal time, yeah, and you find someone putting their cup of tea in their food, whereas they're supposed to eat this food, don't just watch. Please try to prevent that. Yeah? If someone is walking, they're supposed to walk with a walking aid. Please, what are you supposed to do? Remind them to take the walking aid, because if they don't, they're gonna fall and you'll be dealing with bigger problems than that. So dementia awareness. Yeah, and also making them feel happy. You know, you promote like some activities in the homes there. You liaise with the activity organizer. I call them activity organizer or activity manager. Organize with them and you'll be able to put a smile on these people who have dementia. Then we have number 9, Care Certificate Standard 9, mental health awareness. Yeah, I think I've just mentioned the mental part of it. Of course, if someone doesn't have mental capacity, guys, you need to recognize that. Yeah, that's why it's called mental health awareness. So you need to recognize that so that you can know how to help these people, so that don't harass them if in case they have done something, maybe it wasn't even intentional, yeah, or maybe someone is agitated. Have a way of approaching these people, you know, softly and calmly and softly, and talk to them softly. Yeah. Then we have Care Certificate Standard number 10, safeguarding adults. So here we have safeguarding adults, because most of the time when you come to take care of the elderly, guys, safeguarding, just like the way I've just mentioned now. Let's say you see one of the residents is being harassed by either one of the colleagues, staff, yeah, or maybe the relatives, yeah, or maybe a resident harassing another resident. How are you supposed to handle it? So in this course, you will have the guidance of how to handle such situations and even how to report these situations. Yeah. So once you see something is happening and it's a safeguarding case, please approach this situation and stop the incident, whatever that is happening, and also report to your line manager. Okay? And if it's let's say you are working in a domiciliary care, maybe at someone's home, and maybe the relatives, they have come and you're seeing the way they are maybe acting towards the resident or your service care user, the one that you are attending to, you have the right to call. You can even call the police. You have the right to call the police. Yeah, you can call the social care worker for these people. Okay, so yeah, you need to be aware of this as well, about safeguarding of adults. You need to protect these people. And then we have Care Certificate Standard number 11, safeguarding of children. The same way, it's only that is the vice versa. This time now you're dealing with children. Probably let's say you're working in a house, yeah, and then probably the parents of this child, maybe they're mistreating them, or maybe the neighbors, or what's happening, or maybe they are not even provided. Guys, if you don't provide food, if you don't provide for these kids, that is safeguarding. You need to provide for them, even clothes. If you don't provide them with clothes, also can lie in the safeguarding thing. Yeah. And also maybe let's say there's a child, probably you take care, you come in the morning, domiciliary care home, domiciliary workers, as I mentioned in one of the videos, that the time is varied. Yeah, your time is varying, and at times you're required to come 8 to 6 or 8 to 8 or even 10 to 10. You know, your shifts, they're like that. Do you know something? In case you are taking care of learning and disability, let's say it's a child, and you go, and then you find when you left the previous shift, let's say yesterday, and this child was okay and everything was okay, and then when you come in the morning, this child has bruises, you need to report that. That is a safeguarding case. As well as when you're working with the elderly people in the care homes, in case there are unexplained bruises, they need to be reported as safeguarding. Okay, then care certificate standard number 12, it is basic life support, BLS. So you will do this one. So I would advise you do this one. Probably it's theory, the one that you're doing online. At times they have like clips, you know, small clips to show you how basic life support is done. But I would urge you, or I would advise you, even if you have this certificate with this one, please get a course wherever you are in your country. Mostly Red Cross, they have all these courses. The ACLs, advanced, you know, life support. You have the BLS. Do those courses. Go and do it. Like, participate in a physical class. Do it physically. And then we have number 13, care certificate standard number 13, health and safety. Of course, health and safety, you know, you work towards the general health, promoting the general health of this particular person. Also, just like the way I mentioned earlier, like dementia awareness, and you know, this person is at risk of falls, you should be reminding them that they should use their walking aids. So that one is you're promoting safety. And then we have care certificate standard number 14, handling information. So information governance. This information governance, guys, it's about confidentiality. So if you're working in a care home, the rule is, or the policy, all the documents, they are supposed to be kept in a lockable drawer or place where it's lockable. Not everyone who comes in the home, they can access these documents. No, not everyone, just because they say this is my cousin, this is my brother, this is my sister, this is my mom, this is my dad, they come to the care home and tell you, I need to see this document. Not just a police should come and claim they want documents. No, the only person who should access the documents, and there's a process of getting that document, is the NUK, who is the next of kin. And if they want this information to go to someone else, also they'll give the authority. All right. So confidentiality as well. Then care certificate standard number 50, infection prevention and control. Infection prevention and control. Of course, if you're working in a care home or in a home, even in your own home, if you want to cook, you always wash your hands. Because you don't want to introduce the germs. Maybe you've been working the whole day, or you are outside there, or you've been cleaning the house and stuff, then you go cook food with the same hands without cleaning. No. So in the care setting, as a carer, you need to wash your hands before you handle any patient or any resident. You need to wash your hands. You need to make sure you change your gloves, and you have to make sure all the PPEs, including the aprons, they are put in a designated area, the segregation area. All right. And also make sure you don't share gloves from one person to the other person. Let's say if you're working in a certain home, not nursing home now, in a home, and then probably you are providing the hygiene, maybe toileting, and you are using gloves. So you before you touch this service user, you need to wash your hands, put on the gloves. Then after you finish helping them with the toileting, you do what you have to do. Then you remove the gloves and wash your hands again before you continue with the rest. So guys, that's all about you see why you are required to have the care certificate course certificate. Yeah, you've seen why. The standards I've already explained, and even as guys, we usually do this yearly, like annually. You have to renew them, so it's very, very crucial to have this. Yeah, and then we are going to the second one. The other one was NVQ. Let's say level 2 diploma. Okay, let's see. Level 2 diploma in social and healthcare. All right. I wrote a diploma in anyway. You understand what I mean? So here we go. So you see, there are so many here, guys, but make sure anything that you do, as I've said, I would recommend the first one, you know, that one for the 15 modules of the standards, yeah. But if you have to do this, because you see, mostly if you're in UK, guys, you can access these courses even here. You can do them online, or if you are there and you want to do something extensive, you know, you can do this. So let me look for it, and yeah, adult social care. Okay, now I found it, about the level 2 extended diploma in health and social care. This is where you want to do something extensive, more than the standards, the 15 standards of social care certificate. Yeah, so we have this level 2 extended diploma in health and social care. So in this page, guys, associating of learning, you know, I've been looking, and you see there's a basket here. So once you buy the course, you just add to the basket before you're going to pay, and I'll show you. So this one, this also, you can also search here, yeah, and I'll search level 2 diploma in social and healthcare. So you search, it's still giving me the same, right? Yeah, because this is what I had searched, and I know I've shared this page to a few people. So you see, a nationally recognized qualification, our CAEC extended diploma in health and social care can take your nurturing capabilities and provide you with the tools to work with children and young people in the future. All right. So it's not paper-based. In your case, if you are taking this course in your country, it will be online based. Yeah. And then if you want to pay in full, it will be 375, and then there's this option of enrolling now. Yeah, if you want to pay monthly, you pay monthly. You'll be paying that £3.75. So it's your choice. Choose either to buy the whole course, or you do what you do with the installment. So over 10 months, and that's £7.50. Okay, that's £7.50 deposit if you choose to pay monthly. But guys, I have to tell you something. The time I was reading this, because I'm not reading it now, I noticed somewhere where they were saying you don't really have to take a whole year or the 10 months to do this course. There are people who are doing this course within 3 months, they are done. There are others who are doing, because I know most of us, we are working other places. If you're not able to finish within 3 months, you can do 6 months. Or if you feel like you're not ready maybe to come and you want to prepare your family and stuff like that, you can do the whole year, yeah, course. So I don't know whether you want me to read something brief about this course. A nationally recognized qualification, our CAKE Extended Diploma is in health and social care, can take your natural nurturing capabilities and can provide you with the tools to work with children and young people in the future. From social care, early learning and child care, and learning development to working within the support service, this qualification is designed to guide and assess your development as you build your skills and knowledge. In fact, this course has been designed by the CAKE, who specialize in care and education sector qualifications and whom use leading industry experts and specialists to ensure you receive everything your future employers will expect of you. With just 360 hours of learning and 1 year to finish it, you can achieve an excellent knowledge base in health and social care that can enable you to go to further vocational training and placement opportunities. More importantly, you can complete this course from the comfort of your own home at a pace of your choosing. You can explore the fundamental principles of health and social care, delve into equality, diversity, and rights, and give your career the kick start it deserves. So, course benefits comprised of 2 parts: the certificate and the extended diploma. Wow, that's why I'm saying if you do this course, guys, it will be a bonus. It will be a bonus. You don't know, if you're patient and you get to do this, you never know, you might even be picked, you know, because when you write your CV, guys, you have to include the courses that you've done. So if someone sees you've done such a course, they might opt to take you than taking someone who just did the standards. But it depends, guys. But you see, the example that I gave about the requirements of the employer, they had given all the 3 categories of these courses. So yeah, so this intensive course can provide a strong foundation of learning that can be used to progress your career. Alongside developing your understanding and knowledge of this highly rewarding field, every assignment you complete will test your competency and ability to transfer these versatile skills into a working environment. Guys, it's so much here. Understand discrimination. Maybe I can just point out a few points. So if you do this course, so you understand equality, diversity, and inclusion in health and social care. Yeah, I won't go deep, but I will just outline. Then number 2 there, it will be understand discrimination. Remember, some of these points you've heard me mention to the previous, the 15 standards. You understand what I mean. Then understand person-centered practice, the same. And then understand human growth and development across the lifespan. Understand influences which impact upon human growth and development. Understand significant life events across the lifespan. Understand how health and social care services meet the care needs of individuals through the lifespan. And then we have safeguarding central to high quality health and social care provision. Oh guys, there are too many. But don't forget, guys, as I said in my previous video, always remember to go to my description, because I will leave these links in my description. Either it's a job application link, I'll leave it in my description. Always remember to click my description. So I will leave this one in that, so I won't go through it. And then the other requirement, or the other recognized course certificate, it's NVQ2. NVQ, this on the head side, to NVQ2 social and healthcare. So you search. No results. How? I think at the moment, guys, this one NVQ in this particular online provider, course provider, they don't have the NVQ2. I don't know why, because I'm very sure I had searched earlier. Actually, even today I had searched earlier and it was there. But now we can check about this one: Adult Care Diploma Level 3 or Health and Social Care Diploma Level 3. Q. Let's see what we'll have. So this qualification is an ideal course for those looking to embark on a rewarding career in the health and social care industry. This is an ideal course if you are looking for or currently working in care roles in residential settings, home care and day services. This is an occupational qualification which can also be used towards accessing nursing courses in university. Yeah, so it's the same, guys. So once I send you the link, make sure to go through, you see what they are providing. Yeah, and you see you still have the option online based. If you're doing online, of course, and then you pay in full, it will be £390, and there's an option of enrolling. Okay, you can pay monthly £35 and 10 pence. And I know they were saying they could deliver like everything that you require. Let me see. Fundamental Standards 2015, Duty of Conduct, effective communication in workplace. Yeah, so it's the same, guys, with the 15 standards of social and health care, like the care certificate. With the 15 standards, it's the same. It's only that now these ones, they are diplomas, and they are like extensive. They are not just the basics. They have gone deeper, and that's why I'm saying, if you're lucky and you can afford these, guys, you can always like go for these ones, and that way your employer will be like, wow, at least this one has more knowledge on this, and probably they might pick you and leave the other person. I'm not saying they're gonna leave anyone. As I said, they already said they put across these 3 accredited certificates, yeah, the courses that you can do. So without further ado, guys, I'll go back and I'll show you the free courses that I said, because I can see our time is really gone. But guys, in case I've missed anything, once you get into this association of learning, you can search with that search, and you can search whatever. You can type in here whatever that you want to look for. Now I found what I was looking for. So there's this course, Principles of Nursing Practice and Health and Social Care. So I found this one. You see, I've just gone back with my my back tab, and I had done this one. I had looked for this, and I can see, guys, there's a discount. So there's a £50 discount. If you order within this time, you can see they are showing up here, and use the code SAVE50. So if you manage to book for this course, you can save £50. Yeah, okay. This is what I was looking for when I was going through there, when I couldn't find the results, but this is what I was looking for, guys. So it's Principles of Nursing Practice and Health and Social Care. Yeah, and when I found this is when I had typed about the NVQ level 2 and even the level 2 diploma for the social and health care. So this course combines out certifications for nursing and social care, enabling you to apply not only basic nursing principles, but also to understand the social care needs of your patients and how that can best be met within the British healthcare system. Perfect for social workers, paramedics and carers. So you see, guys, where if you're coming as a healthcare assistant or a carer, you will qualify once you do this course. Like, you can do this course for that. The same thing you see about the payment, online based. So if you're paying monthly, it will be £48.60 over 10 months and £54 deposit. If you are to pay in full, it's £540 to enroll. Yeah guys, and I think I won't go through what it is about, but if you go online to this one, you can see my screen. Just search for this. Once you Google and then you tap somewhere and it shows you this tab, please look for it here. Yeah, here you can see I had already opened the tab here. So when you see this purple, it shows from blue to purple, means I had already opened the page. Yeah, and that's what I was talking about, guys. So these courses, they are totally free, guys. So just go there, do the enquiries. You can see this enquiry box there. Do the enquiries. You will complete your inquiry on the provider's website. Yeah, so you can do the enquiries. This children and young people's mental health. So probably know that's what you want, but these courses, they are free. If you have time, guys, if you are finished with the 15 standards, which is just £10, you can do this free course to supplement, and make sure you include them in your CV, guys. Don't forget, this one will sell you, like it's gonna sell you your work. Yeah. So that one is for children. Level 2 certificate in caring for the elderly. If I were you, I wouldn't fail to do this level 2 certificate in caring for the elderly. It's free of charge, guys. I wouldn't fail to do that, because most of the time if you come to the UK, you'll be dealing with the elderly. So you better do this one. It's the same here. Level 2 certificate in caring for the elderly. Develop your knowledge and understanding of caring for the elderly. It's free of charge. And then we have level 2 certificate in understanding dignity and safeguarding in adult and health and social care. Guys, make sure, this is just my advice, what I'm thinking, because at the moment so many people are applying for these carer jobs here. When you finish your 15 standards or the course that you're gonna do, when you choose amongst the three, either the level 2 diploma for the social and health care, or the NVQ2 in social and health care, or you do the 15 standards for the care certificate, please do these free courses. It's saying, like here, it's saying this one is 4 weeks self-paced. And you even have a tutor if you need someone to help you. Yeah. And I think there's somewhere I had read they are accredited. 82 free online health and social care courses. Even myself, I should do these ones because they will help me in future with my CPD when I'm doing my nursing revalidation. Yeah. So yeah, that's it, guys. So just remember, I'm going to leave all these links in my description below, so you shouldn't worry. All I said is that if I mention something, you can always post. If you don't know what you're going to search online, always post the video, note down. Yeah, like now, if you want to know this course, who was the provider of this course, it's Read Courses. The other person who was providing, just get to know, just post the video, write down, so that once you're done with the video, you can go through your notes and then you can get to search. Yeah. Okay. I hope you've learned something, and now you're not worried where to get the health caregiver certificate. If it's not provided in your country, if the nurse aid is not in your country, because like in my country it's not there, in Kenya, go online. This £10, 1,200. It's cheap. Like it's very easy. Once you come here, the £10 is within 1 hour, because we've seen in the previous video that you'll be paid £10 and 10 pence for your 1 hour job. Okay, so yeah, what I can say, if you have any questions, please leave them in the comments section below. And thank you so much for watching this video. If at all you've not subscribed, please remember to subscribe. I already appreciate your support. Also, like this video and remember to share this video, guys, and I already appreciate your support. So thanks again for watching this video, and I'll be seeing you in my next one.